Endless to-do lists and mounting debt mar the biweekly Guam Memorial Hospital Management Advisory Team meetings that aim at addressing the cash crunch at GMH. At the latest count, GMH has nearly $26 million in account payables. Chief Executive Officer Peter John Camacho.
I'm not sure that we can ever say that the hospital won't have any outstanding payables. And it's trying to get to that point where we can manage that.
The backlog in payments has caused issues with vendors, and most recently, the hospital's trash collection.
We're actually in the process of correcting that, Issa. There was a buildup of the trash that had been collected, but we've been able to, working with the vendor, to be able to come and pick up the trash, remove it, and then, moving forward, we'll make sure that we're going to continue to maintain that.
Camacho says because the hospital doesn't receive enough revenue to cover its expenses, as it hasn't for several decades, it's been a balancing act between paying vendors and purchasing much needed supplies.
When the governor stepped in and committed the government's resources to help the hospital, I think that was a demonstration of his commitment to make sure that the hospital will continue to be able to provide services to, those who come here.
Nevertheless, all hands are on deck, working on immediate cash needs at GMH. But HMAT member Will Castro said the hospital's long-term viability is also a key focus.
In this meeting, across the table, everybody was in agreement that there are some issues that are much bigger than the hospital, that in fact we have to tackle the entire health provisioning system comprehensively and almost in a unified fashion. That's a system of care that has to be addressed even outside of the hospital.
This sentiment was mirrored by a recent report by the legislature's GMH task force. While these stakeholders continue to work on an influx in cash in the short term, many agree that a complete change in our island's system of care will be the long-term solution needed to keep the hospital running for generations to come.
And I think Hillary Clinton is quoted as saying it takes a village. It's going to take our island community to come together to be able to address these problems.
Reporting for Guam's News Network, I'm Issa Baza.